Hi Ashley, nice to see you again. How are you getting on?
Good, thank you. Yeah.
How long has it been now you've been in your role?
I started in February, so I think it'll be about 7 or 8 months now. Feels like the time's gone really fast.
All right. To me, it feels like you're new in public health manager, aren't you? So,
yeah. So I mean, this is my first role, properly within public health. So all of my knowledge has just come from the past 7 months or so.
Yeah.
So there's a lot to take in. I feel like I'm slowly but surely finding my feet. But yeah, it's been good.
What did you do before you landed here?
So I previously worked on a grad scheme where I did have a placement in public health in the mental health department of that, which was really interesting. And I've also worked in chief exec's department in children and families, and I really liked sort of public sector world. I kind of knew when I came out of uni, I knew I wanted to work for either public sector or voluntary sector.
Right.
So just found myself on that grad scheme, was really good, and then managed to find this role here and been loving it ever since.
So you've sort of gone through sort of phases and then known exactly what you want, and then through the grad scheme, public health was something you wanted to do.
Yeah, I think that's the area that really stuck out for me. I really liked how it kind of works on a strategic level, but I like how much involvement that we get with sort of operational colleagues as well. That's something I've really enjoyed about it.
It's interesting, isn't it, how we have different paths into public health. Mine wasn't intentional.
Yeah, what was yours?
So I worked in finance when I was very young, and then moved to the domestic violence sector and age concern. But that's when I realised the impact wider determinants have on people's holistic health, and that sort of got me into sort of self-care in the NHS and primary care trusts that they were called at the time. So self-care lead and things like that, and then it was health promotion. And then I landed in public health as part of the transition of public health from the NHS into local authorities.
Okay.
So it's interesting how we take different paths into public health.
It is.
And sometimes it's intentional and sometimes it's not. It's just a different way in.
Yeah. So you saw sort of public health coming into the local authority then?
Yeah.
What was that like?
Lots of uncertainty as to how that sort of fits into. I can't say there wasn't any politics in the NHS, but then moving into local authorities was actually a very political sort of environment. So there was that to navigate, as well as navigating how public health will look, being governed differently as well. So there was lots of uncertainty at the start, but it was exciting as well to do things differently after such a long time.
Yeah.
So it was a mixture of feelings, I think, at the time.
Yeah, I bet. Oh, that sounds really interesting.
Yeah.
And then there was a few changes sort of going and working for everyone, wasn't there, when we had sort of COVID and stuff come through?
So lots of changes happened over the years.
Yeah.
So my roles, I mean, since I started, have involved working on mental health agenda, the sexual health agendas, domestic violence, including FGM, and now I've landed on children, young people and maternity agendas.
Oh wow, so you covered a lot then, haven't you?
Yeah, it seems like it. Yeah, it's quite, and they're quite big agendas in their own rights as well. So it gives you lots of experience, and it's such a privilege as well to be able to serve the population like that as well.
Yeah, I bet. I think my agenda is substance use at the moment, so I work closely with some mental health colleagues, but it's sort of alcohol and drugs is my main area. So I've not got as much experience as you, but I'd like to get there one day.
Hopefully, yeah. So even though you say alcohol and substance use, it's when you sort of say that, it sounds really simple, but it's not, is it? Once you start working on it, then you realise how vast each work stream is. And there's so many different people involved as well. So there's our team within public health, but then there's the providers, there's the police, there's county colleagues, there's NHS. So there's so many people involved in it, and from the beginning I had no idea it would be like that. So that's one of my favourite things about this job, I think, is how many different people you get to meet and work with and sort of see different systems working together. And what sort of other skills do you think you're picking up along the way? I know it's not been very long, but what do you think you've learned? And you'll be amazed to think about and put into context what you've learned already in such a short amount of time.
I think the main skills that I've really picked up are just communication and networking skills, because there are so many different partners and different relationships as well, and that's been a bit of a learning curve for me, moving from a grad scheme where it's very much sort of being told what to do to maybe move into more of a sort of decision making role. That's been really interesting, but I've been so supported in working out how to go about doing it, so I'd say that's definitely my strength, but it's also something I'm still in the process of developing as I go.
Yeah, and I think if I think about the transferable skills, without a doubt, partnership working, like you said, and stakeholder management are probably the ones, even if you come in with that skill set, it's something you refine all the time, and it's such a big part of what we do, along with sort of program management and project management, which you will have done in your grad scheme. And I think probably one of the other transferable skills is a political astuteness, which I think is something that you really are honing all the time and refining that sort of skill. That
is definitely true. I think it's quite easy to forget that you work in a political organisation a lot of the time, and so being at that kind of more strategic level, when you see how decisions are made and how they sort of progress to councillors, that's always really good to kind of keep in the back of your mind, that that's always an audience you're going to have to try and present your case to.
And then that sort of links to the influencing and negotiating, which we're doing all the time as well.
Definitely. So what skills do you think that you've kind of developed? I think you've had more time to do so.
So I think in addition to the sort of transferable skills that we've just talked about, I think the public health technical skills. So I did my masters in public health on the job, so while I was working, which is quite interesting, because I was working for a number of years before I did the masters, so it was interesting how I learned the sort of context of what we do and how we do it, why we do it. So so the academic side of it, and then sometimes the penny dropped, that's why I'm doing this. So it helped me frame everything I do into that sort of context. So I think the sort of technical public health skills are like health needs assessments, evaluations and things like that, which I think were really helpful and we use all the time. And I think, interestingly and unintentionally, the additional skills I think I've picked up over the years are commissioning skills and knowledge, and quite a lot of it. And contract management skills and knowledge, which was never in the sort of job description, but it's things that you just do as you go along, and then it just becomes second nature as well, and you start doing it subconsciously, and then you've got to at some point stop yourself and think, actually I've got to go and then get the expert advice now. It's something, I've got to draw the line somewhere. So, and that's what I love about this job. It's so flexible and adaptable, and you actually decide where you draw the line.
Oh, that's really interesting. Because I've since starting, I've worked with contracts and I've worked with commissioning, but not really had as much involvement myself, because I am still finding my feet and developing within my role. So it's interesting to hear you say that you not only work closely with them, but pick up those skills yourself and implement them in your work.
So you said you enjoy the working with partners and things. Is there anything else you think you enjoy so far?
I think I really like the way that we kind of share information and share learning across the team. I feel like we've got a really good team that we work with. Everyone's really friendly, really nice, and there's nothing that's too big an ask for anyone. So I feel like I've learned a lot from other people as much as I have from doing the job, and sort of trial and error with things, and I think that's something I've really enjoyed.
And that's one of my favourite things about working in public health, is the local and national public health community. So once you're in this a while longer, you'll notice that it's like a wider community, and even if you contact somebody in another part of the country and ask them to help you with something, will do that. And I just think it's such a wonderful culture of can do and helping people for the greater good. you'll find that people are just so willing to help, and that's the most enjoyable part of this job, I think, the way people, that togetherness for the greater good.
Yeah, I think that's definitely what I noticed as well when I'd had my first placement in my last role on the grad scheme. Was it worked differently from other teams. It felt a lot more connected, and that's something that's only really magnified since joining here. And it seems that the team's grown quite a bit as well.
Yes,
so
yeah.
I've only ever known it to be a nice big team, but you must have seen it sort of go through all those stages.
Yeah, so when we joined the local authority, it was a big team like this. And then over the years, it shrunk to a very, very small team. And then in the last couple of years, with the new leadership, it's just expanded again. And it's been amazing to see all of those changes, and the way we've handled them, and all the opportunities, and even when it's been very challenging, it's the way people have stepped up and managed things. It's been just a privilege to be part of all of that, to be honest.
Yeah.
Especially in Nottingham, yeah. So is there anything that you think you're so proud of, very proud of, or
I think
within this time?
Yeah, I think the way I've picked up skills quite quickly, I think I'm quite proud of. I think it did feel like a bit of a scary start at first, sort of just going from a grad scheme to a sort of a grown-up job.
Yeah.
So I think just the way I managed to pick things up, and I like to think I've slotted into the team quite nicely as well. Yeah, I think really just go starting off nicely, and there's been a few projects I've been working on that I think are going well, and you know, still works in progress, still lots to be done, but it's nice that I can still see a noticeable difference in performance from when I first started to now, and that's very motivating to see that I am having an impact there.
Yeah.
What about you? Have you got any key sort of milestones that you're proud of from your time here?
I think without a doubt, I think it's the way we responded to the COVID-19 pandemic in Nottingham, because at that time we were a very, very small team, and I think I will always be proud of that. And it was because of really good partnerships, partners and stakeholders coming together, working pragmatically, dynamically, and just everybody working for the same purpose, with the same outcome, to meet the needs of our local population. And I think it was really challenging, but at the same time it must have been so much more character building for all of us, each and every one of us involved in that. And I think I will always be proud of that, and always think it was a privilege to be part of that as well.
Yeah, definitely. Oh, I bet you are proud of that. I mean, at the time of COVID, I hadn't started my career yet, so I was based in uni and found that challenging enough. But sort of carrying out a full-time job, working for, you know, with vulnerable people and trying to make sure everyone's got their needs met, I can imagine would be quite the challenge. So
how did it feel for you to be just as a member of the local population? How did that feel for you, as you know, what sort of services we're doing? How did that impact on you? Did you even notice what was going on in terms of managing public health?
Yeah, I think, I mean, COVID is the first kind of real time I heard about public health, because before that I knew about the NHS and I knew about local services, but I didn't know so much about what public health delivered. So it was interesting to me to learn a little bit more about that. And I think the way people communicated with one another, you know, not just through organisations but through friends and family, really changed a lot. And that was something, it was quite different and quite difficult to get used to. But it now feels like there's no going back, really. We're sort of remote working with one another. Like my only experience of work has always been remote working. So the idea of sort of coming into the office every day does feel like a bit of an alien thing to me. So that's definitely something that's a bit different for me, I bet.
Yeah, so it's interesting for us in public health to hear about the impact COVID has had. So in addition to the way it's changed and how we work, but also how people perceive public health. So and I think that's because of COVID, but a massive change over the last 10 years, that people didn't really understand what public health was, and now, like you said, you understand what public health is and what people in public health do for the population. But what I worry about, because of seeing that happen, is a few years down the line, are people going to start thinking public health only do outbreaks?
Yeah.
And how do we manage that as well?
Yeah, that is interesting.
Yeah.
I mean, I think from my perspective, I guess that's how, you know, COVID is how I found out about public health, and so it gave me that awareness, and then led to me ultimately getting a career within public health. So I'd like to think that maybe now that there is an awareness there, it will stay there, and people will remember, you know, the good work people put in and how hard everyone sort of came together for it, and understand a bit more about the wider role of it as well. But maybe that one will just have to be one we see what happens with.
That's it. And I think it's led to an understanding of health inequalities, hasn't it? And you know, disadvantages in populations. So, but like you said, let's see where we go from here and where it takes us, and where it takes the understanding of public health as well.
See where we are in the next 10 years.
Yes, and hopefully you'll have a lot more by then to
I'll be sat on that side of the chair.
yeah, and look forward to it.
Yeah, me too.